Hello there. So today we'll be talking about sources of infection. So the basic source of infection in hospital is direct contact from either from the surgery team or from the patient, from the instruments. We also have airborne contamination, and also now it's usually from the patient. So the principal objective in the control of the operating room environment is that the sterile air reach the patient without mixing the airflow over the staff, meaning there is no recirculation over the operating area. The operating area needs to have clean air. So the air exchange rate around the operating theater should be about 25 ACH, and the humidity preferably is 50% plus or minus 5% in the OT. But I'm sure you know that being in Malaysia, our usual humidity outside is 80 to 90%. So our hospital, usually they have to use heater and then to dry out the air and then cool it down back to the operating theater temperature. And the velocity over the wound site with the surgical site of the OT of the patient should be around 0.25 meter per second. This is based on HTM 2025 standards. The theater conditions that should be maintained, the temperature is about 17 to 20. This is also to reduce the bacteria infection rate within the OT. Next, what we're showing you right now is, I'm pretty sure most of the OT staff here would know this is a traditional laminar downflow. I think 80 to 90% of the hospital in Malaysia uses this system. So for this system, it's a continuous airflow from the ceiling that comes in from above towards the sterile working area with the exhaust, usually at the four corners of the room. So this later we're going to explain further on this. So this is Johnson's solution. Johnson's solution to the operating theater. This is our guided airflow system. So for this, we have a guided airflow on the corner here that would direct the air directly to the surgical area. So to achieve this, we did some CFD, or computational fluid dynamics analysis, on the guided airflow. We used a software called FlowVent. So this one would help us to model the environment, the fluid, the airflow, both the temperature distribution and also the particle distribution, allowing the design and variation to be tested before we actually construct the prototypes. So as you can see here, this one is a comparison of how it looks like on the CFD when we did the study to compare with the laminar airflow and the guided airflow. So as you can see on our left, the red area marks the very high velocity or very turbulent air. So you can see the laminar airflow coming from above would have very high velocity, and it's quite turbulent, and not much of the clean air actually reach the patient, because you need to consider that there is a OT light, there's a surgeon there, and also other equipments that might be blocked and causing other turbulence. Whereby you can see on the right, our guided airflow system, you can see there's less red coming from the guided airflow. So it's a very gently moved clean air from the guided airflow towards the surgical area. And this then exhausted. You can see the far right of the picture, there's a very bright red. So that's our exhaust system that's extracting all the so-called dirty air outside of the surgical room. So back then we did some tests, was conducted in Sweden, which here are the organization that was involved during the testing for the guided airflow system. And here we're going to talk about the energy consumption and also the accepted CFU. CFU is the colony forming unit in the OT. So this is this diagram shows you the difference between the bottom one is our guided airflow, and we have 3 conventional system that they test. So the one on the left here that we're highlighting is the CFU level before the surgery starts, meaning when the OT is either empty or before the patient comes in. So you can see even before the surgery starts, we are starting at a lower CFU than all the other traditional methods. And once the surgery starts, it's common that things starts to fluctuate and varies between the different systems. So you can see some of the systems they can handle better, but some towards the end or towards the during the surgery, their CFU level starts to increase, whereby our Johnson guided airflow system, it still maintains the 0.5 throughout the surgery. So how we achieve this is during commissioning, these are the tests that we have to conform or to pass before we allow any surgical operation to be done in the OT. So we do an airborne particle count test, room preservation test, bacteria count test, fungal count test, temperature, and also humidity test. So to summarize, National Medical guided airflow system for the operating theatre, it ventilate a larger sterile area and is able to achieve less than 10 CFU at reduced airflow rate. And thirdly, it lowers the operating cost due to the reduced air conditioning load. And also it can maintain comfortable temperature at 17 to 20 Celsius. Here is we're going to show you a video of the airflow visualization test we did in an OT in Sabah. So you can see that the airflow coming from the guided airflow is very gentle. And here they are showcasing you you can see how the clean air is pushing all the dirty air towards the exhaust, which will be on the left side of the video. So you can see not much of recirculating air going back to the surgical area. So here on the left, you can see is our exhaust for the guided airflow. So everything is directed from the surgical area to this exhaust at the end of the room. So how long does it take to install the guided airflow system? On a, sorry. So it is possible for us to install it over the weekend, which is 2 days. But this is with pre-planning and confirmation on the compatibility of the AHU with our guided airflow system. And yes, we are able to retrofit into current OT configuration, provided everything is in working condition and is functioning well. And cost of all this is about 150K just for the guided airflow system. And you can add in about another 100K with if you need to add the AHU or need to change the AHU. So here are some of the install base that we did here in both in Malaysia and also outside of Malaysia. So we have quite a few in Malaysia, and even HKL we have 2. In Sabah, KVJ Ipoh also have, I think they have 2 units over there. So most of our installation base is in India, and we have some in Singapore, Mauritius, Sri Lanka, and Yemen as well. So next, we're going to talk about the ventilation in the ICU. So shown here is a typical ICU layout of how you see current ICU in Malaysia, how it is. So you can see on the right, it is most ICU come with a ceiling mounted aircon system whereby the air is blown from above. However, during the current pandemic situation, we see that the solution that hospitals do is that they use plastic sheet to cover the patient bay, which is although it might help, but it also creating an isolated whereby some of the patient are not getting the clean air that they need. So it further restricts the clean air movement in the ICU and also create more turbulence. So our solution for this is to give you a product that can give you a better patient engagement and also protect all the healthcare workers from infection coming from the patient or vice versa. So we have here is a Johnson Medical IsoGuard, which is the same mobile guided airflow system, but it's a mobile version and it comes with the IsoGuard is a temperature sheet. And the price for the whole system is about 28,000. So here is a test that we did internally. So this video shows you that you see how the smoke test show the airflow being guided towards the patient head. So at the end of the table near the patient head, they would have an extractor that would extract back all the dirty air and filter this out before recirculating it to the patient again. So to summarize, this area ICU, CICU, PICU, NICU, and also the emergency care department environment that we need to take care to reduce infection from this area, both infection from the patient and also from the healthcare workers to the patient. So that is all. Thank you, everyone. So guys,